Normally, our bodies are amazing at healing wounds of all shapes and sizes, but sometimes wounds don't heal as they should. These chronic wounds impact about 6.5 million Americans. That number is only expected to increase, and these patients often require specialized care over the course of months to achieve healing. Unfortunately, these patients are often what's called lost to follow-up, which means that they don't come back to the wound clinic even though they were supposed to. When this happens, I can no longer deliver the care that they need to heal, which makes me ineffective as a provider, potentially hurts my patients, and wastes valuable resources. The authors of this paper thoroughly evaluated 200 consecutive patients and found that essentially half of their patients were lost to follow-up. Comparing those who did come back versus those who didn't, overall they were actually very similar in terms of medical problems and wound characteristics, but there were a few factors that were predictive. Men were twice as likely to miss follow-up appointments compared to women. A driving distance of greater than 20 miles made patients 3 times less likely to come back, and foot wounds were more likely to come back compared to ankle or thigh locations. Now, this paper doesn't fix the problem of chronic wound patients not coming back to clinic, but it does highlight just how big a problem this is, with half, 49.5% of their patients not coming back to see them for wound care. These findings justify development of outreach programs aimed at both improving transportation to specialized centers and also shifting follow-up care to in-home nurse visits, telemedicine follow-ups, dedicated case managers, and potentially satellite wound care clinics to improve access to care. Chronic lower extremity wounds are a very common problem, but there are a number of different factors at play in every community. The authors thoughtfully evaluated all relevant patient characteristics, wound types, income levels, insurance status, and specific community travel issues. And while the findings of this work are certainly important, perhaps the more significant contribution is the analytical framework it provides for other wound care centers to apply to their own patient populations and determine the specific risk factors for patients falling out of their system. Identifying these community-specific areas for improvement will streamline the delivery of evidence-based multidisciplinary wound care.